Here is your question. Okay, so if you have read and understood, considering it history-taking station, kindly please begin.
So I'll wash my hands. Hello, good morning. My name is Dr. Ulfat. I'm one of the surgical doctors working here. Can I please confirm your name and date of birth?
My name is Tom and I am 56 years old.
Nice to meet you. Can I address you as Tom?
Yes,
Mr.
thanks.
Thomas. Okay, good.
All right, Mr. Tom. So if you could kindly have a seat. I've been
Thank
asked
you.
to ask you a few questions regarding your condition. Would that be all right with you?
Yes, doctor, please.
Okay, so what brings you here today?
Yes, doctor, I have been suffering from this blood in my urine for the past one month.
Oh,
So
I'm
I
so
am
sorry to
worried
hear
about
that. Yes. Uh,
it. That's
eh,
why,
uh,
doctor, I came to you.
okay, all right. I'm so sorry to hear that. So you've noticed that you've have blood in your urine. For how long have you said that you've noticed this?
Almost 5 weeks, doctor.
5 weeks. Okay. And is it there all the time, or is it just when you're at the end of the urination? Do you notice that?
Doctor, it's there all the time.
Oh, okay. Is it like, how did you feel? How did it start? Was it like one day all of a sudden, or was it increasing in gradually over days?
Yes, doctor. I didn't notice it earlier times, but in last 5 weeks, I think it was gradually increasing, and maybe since last 4 months, it's almost last 1 month, it's almost like same only.
Okay, so let us just for clearance, are you sure that it is you're passing it in urine and not anywhere else?
I am sure, 100% sure it's in my urine.
Okay. All right. And do you pass clots?
No, no, I haven't seen any clots. It's usually
Okay.
mixed up.
All right. Did you take beetroot anytime during during this time?
No, 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 I haven't.
Okay. So have you noticed any changes in your weight, any unintentional weight loss perhaps?
No, no obvious weight loss. It
Okay.
was almost same.
All right. And how's your appetite?
Lately, I have noticed a little decrease in appetite,
Uh,
but
okay.
I didn't check any weight,
All
so
right.
I don't know exactly.
Okay. So it's all right. So could you please tell me, do you feel any of these symptoms like, any pain in your lower tummy?
Yeah, since last 2 days, I have some dull pain along my groin area.
Okay. In your groin area, does it go anywhere
Yeah,
else?
too. And it is like low into groin. Some radiation is there, and
Okay.
some pain is there.
Okay. How would you describe this pain like?
It's a dull pain, like
Okay.
aching type.
So if zero was no pain to 10 being the worst imaginable pain, how much would you rate this pain as?
Around 6.
6. Does anything make the pain worse or make it better?
No, I haven't noticed such. But if I take some painkillers, there is some relief.
All right, all right. So what do you think? What do you think you could be suffering from? Do you have any idea?
I don't know, doctor. Lately, maybe I am thinking maybe some urinary stones or something.
Okay, urine stone. What are you most concerned about?
I am worried about these cancers and other things. One of my friend, he had some bladder cancer or something.
Oh,
So hearing that, I am worried about maybe I am also suffering.
oh, I'm so sorry for that. What would you like us to do for you?
I want a full checkup, maybe find out the
Mm-hmm.
cause
Mm-hmm.
and treat it
Yeah.
uh, as soon as possible.
Yes, yes. We will get to the bottom of this. You don't worry, all right? So,
Okay,
if you could
thank you,
just
doctor.
tell me a few more of the symptoms. Do you feel like, when you go to pass urine, do you feel like there is this incomplete sense of voiding that you want to again go back?
No, doctor, no, no, nothing
All
like that.
right. Did you ever have to wake up at night to pass urine? And
Sometimes,
all right.
but not
Is there
daily.
not daily? Okay. Is there any sort like after you've finished your urination, there is dribbling?
No, doctor, no.
All right. Do you have any fever or any fever
No
during
fever,
this
doctor.
duration? All right. Okay. So, is there any problem with initiating urination? Like, do you hesitate to go to the washroom?
No, no, doctor, no.
Is there
No,
any
I haven't
burning
noticed.
sensation?
No, no burning sensation.
All right. Do you see a general practitioner for any medical conditions like hypertension, diabetes, or thyroid problems?
Yes, doctor, yes, I have been visiting him and taking some hypertensive medications, and I think
Okay.
it's controlled.
Oh, all right. Yeah, other than the antihypertensives, do you take any other medications?
No, doctor, no
Any
medication.
blood thinning agent?
No, doctor.
Okay, can you
All right.
summarize your history taking now, please?
All right, thank you. Now, to complete my history taking, I would like to have taken his personal history. He's given emphasis on his occupational history, his socioeconomic history, and also his family history and systemic query. And from the history that the patient has given, with Mr. Tom, who is a 56-year-old man, has presented with painless hematuria for the past 5 weeks, with associated loin to groin pain, which is dull in nature and is relieved by taking painkillers. The patient is also complaining, has also complained of loss of appetite, but is not sure of any loss of weight. If time would have permitted, I would have asked about his smoking habits, if there is any, and his occupation. Considering all of this, I would like to consider a few differential
So,
diagnoses.
yes, what are your
Perhaps
provisional and differential diagnosis?
my provisional diagnosis, considering the patient's age and these symptoms, possibly this is a case of carcinoma of the urinary bladder. But I would like to keep some differentials, like I would like to keep any renal stones. Then I would like to keep an urinary tract infection and any other causes of bladder outlet obstruction.
What investigations would you ask for to confirm your diagnosis?
So I would like to do some routine investigations like complete blood count to check to exclude infection and anemia. Then I would like to do an routine urine analysis along with urine culture and sensitivity. And I would like to do a cystoscopy and biopsy and an IVU and yeah. And an ultrasonography of the whole abdomen and
Okay.
pelvis and a CT scan to possibly stage the disease.
Okay. What treatment can you offer to this
The treat
patient?
Considering that this is a case of carcinoma of the bladder, the treatment would be with multidisciplinary team approach, including an urologist and an oncosurgeon and a general anesthetist. I would like to, if this is a resectable case, then I would like to go for a transurethral resection of bladder tumor, or
Yes.
I would like to go for if it cannot be resected, I could even consider nephrectomy, and non-surgical cases, I would consider chemotherapy and radiotherapy.
Followed by an immunotherapy. Okay, good.
And
Thank you.
immunotherapy, yeah. And if an palliative case, I would consider an ileal conduit.
Yes, good. Thank you.
Thank
Did
you,
you
ma'am.